Tyler is often called the capital of East Texas, a title most befitting, for the city is truly the hub of commerce, culture, and floral beauty in the great Southwest. Industry is on the march in Texas. Markets of the world are accessible to Texas manufacturers. Excellent transportation facilities are available. Texas ranks first in mineral production. No general sales tax. No state corporate income tax. No state individual income tax. No manufacturer's use tax. No payroll tax for revenue. Ample labor supply. Climate is favorable. Tyler is the Texas bright spot. Tyler's fame as the medical center of East Texas is earned by the high standards of health, over which its many doctors and nurses maintain a constant vigil.
We have an amazing healthcare system in the United States, and in East Texas we have a lot of great physicians, we have a lot of great hospitals, but there is something missing, and that's population health or community health. We need to do more in the community, and I think that's really what's wrong with the system.
Dr. Paul McGaha is Deputy Director of the Center for Rural Community Health at UT Health Northeast in Tyler. His colleague, Dr. Carolyn Harvey, manages the Academic Medical Center's Behavioral Health Integration Program.
We've built our healthcare system as the ambulance at the bottom of the hill. So as people get sick and have accidents and fall off the hill, we have a great ambulance that picks them up, great hospital to take them to. We have helicopters that'll fly them. We've got all the structure there for that. But the problem is, it's at the end of the hill after the people have already fallen over. So in population health, we go upstream. We go back to the point that the people get off track and try to help them to maintain their health versus waiting till they're ill and then doing something about it.
UT Health Northeast Senior Vice President for Population Health, Dr. David Lakey, says Americans are facing different kinds of health issues.
Now the type of challenges that we see, and a lot of the healthcare costs are driven by chronic diseases. So if you look at the top causes of death, heart disease, cancer, stroke are the top drivers of morbidity, mortality, why people die, why they get sick, and healthcare costs. The causes of those diseases are very different than infectious diseases with the germs. These type of diseases are in many ways a result of our behavior.
We have high rates of tobacco use. We have high rates of obesity, on average 35% in East Texas. We have poor diets. If you mix that in with a lower socioeconomic status, lower educational attainment, lack of transportation, I'll throw in a lot of behavioral health issues, a lot of substance abuse, you really have the perfect storm, I think in East Texas more than any other part of the state, for poor health.
In fact, of the 28 counties in Northeast Texas, many have the worst health outcomes in the state. McGaha says healthcare providers have an obligation to improve those statistics for more than one reason.
First, it's the right thing to do to help our fellow citizens lead more healthy, productive lives. It's economically important for our East Texas economy to have a healthy workforce, and this would do that too.
The economy followed the money. In 2013, the U.S. spent $2.9 trillion on health care. That's about $9,000 for every man, woman, and child in the country.
We spend a lot of money on health care. That's about 18% of the gross domestic product, but our health outcomes in the United States are not very good. They rank about 40th compared to industrialized nations.
The high cost of an inefficient healthcare delivery system have a direct economic impact on local communities.
So if you're a company and you're deciding, are you going to relocate to City A or City B? And in City B, the healthcare costs are twice as high because people have significant higher rates of tobacco use or whatever. Where are you going to locate? You're going to locate to the healthier city if everything else is equal.
This is why our businesses go overseas and start companies. And a lot of people say, oh, America taxed them out of the country. If you go back and interview these businesses, they went out of the country because of health care. Their health care premiums and budget was more than their hourly salary and wages. If they set their business overseas, where there's socialized medicine and the government takes care of it out of taxes, they pay no insurance. They've just what? Double their profits.
This perfect storm of rising healthcare costs, the threat to business survival, and new types of healthcare challenges requires a very different approach.
So you have to be able to get individuals to change their behaviors, but you also need to make sure that the healthy choice is the easy choice.
With population health, you are motivating your community to be healthy. You are pushing them toward wellness. And you do that by providing the education that they need and explaining it in a way that they really understand it, that they really get it.
Okay. We have to make sure that the health resources are available to everyone. We need to make sure that those are appropriate, that if we tell somebody that you need to exercise, are there the resources there for them to exercise? Are the sidewalks available? Are the lights on? Are gyms open? If we tell somebody to eat nutritiously, can they buy that food in their community? So you have to complement what goes on in the medical care delivery system with public health. And that's where population health is, kind of having a foot in both of those worlds and being able to bring those worlds together to address the whole person.
The UT Health Northeast Center for Rural Community Health is building the bridges that will connect public health and population health throughout the region.
The seeds are being sown and have already been sown here. I think we look to build upon that great foundation that's already been laid with Dr. Lakey and myself on looking at grant opportunities, partnering with communities, partnering with local health departments and other providers, looking at ways we can work together collectively to help our communities in East Texas.
This huge traditional healthcare system that we built, it's driven by revenue and dollars for traditional fee-for-service type activities. Turning the ship around toward population health and being reimbursed for value in the care, the value of the outcome, that will come, but it will take time.
McGaha says the benefits of a population health focus are worth the time and money needed to make them happen.
There are more and more studies coming out that show that lifestyle changes can work. There's a huge study over in Germany, Potsdam, Germany, 6 or 7 years ago, where they took 23,000 residents. They encouraged them to utilize 4 healthy lifestyles. They were not smoking, exercising 3.5 days a week, eating a healthy diet with more fruits and vegetables, and maintaining a normal body weight. 4 things, basically, 4 things. Simple, but not easy, but 4 things. They followed them over 7.8 years. And if you look at the results of those that did all 4 for those 7.8 years, they had a 78% reduction in chronic diseases, which I mentioned before, 78%.
So it does take time to turn it around, but it is possible, and we do have the data analysis tools and the surveying capabilities to measure and track when it gets better.
So it can work. I mean, it's been proven to work, and I think we all here at UT Health Northeast, from the clinician side to the research side, the center that I'm involved in, want to work hand in hand with communities to make them healthier places so our fellow citizens can enjoy healthier, longer lives.
You, your healthcare provider, and UT Health Northeast, working in partnership to keep you healthy, because healthy people make healthy communities. Population health. We're all in this together at UT Health Northeast.